Hello, y'all. Hola a todos. My name is Rachel Ard. I am currently a second year physical therapy student in North Carolina. Today on this podcast, I want to talk to y'all about integrating Spanish language into Doctor of Physical Therapy curriculum. So, before I dive into that, some personal background on myself. I've been learning Spanish seriously since about the end of 2018. I took some Spanish courses when I was in high school, and I didn't really use it much after I graduated from high school, so I lost a lot of what I had learned. When I graduated from college in 2016, I started working as a PT tech in an outpatient clinic north of Atlanta. And during my time there, I came across many memorable patients. One in particular was this older, sweet older lady, like an abuela type of lady that only spoke Spanish. She would often have her sons, her nephews come and be an interpreter for her, or she would have an interpreter come in for her. Her and I bonded really well. I was able to communicate with her in very choppy sentences, trying to recall the Spanish that I had learned in high school. And as I said, we really became close despite there being a language barrier. When the holiday season rolled about, she gifted me with a beautiful set of flower earrings. I was just so completely blown away. I don't wear earrings, but that doesn't matter. What really matters is that I was able to make such a profound impact on this lady's life and just be able to build up a close enough relationship with this patient that she thought of me enough to give me a gift for Christmas. I still have the earrings. I turn them into charms. I wear one as a necklace and the other I keep as a charm around my office. So it's because of this patient that I wanted to learn Spanish for physical therapy. I want to be able to close in on the gap between my future patients and myself, especially if they only speak Spanish. So, not only can Spanish help to improve your rapport with your patients that only speak Spanish, but it can also improve your cultural competency. So, sometimes just not even knowing the language is enough to really understand and connect with your patients, but understanding a little bit more about the culture as well. So, primarily, I started learning Spanish, as I said, to be able to speak with my future patients. But the more I've learned, the more I've fallen in love with the language. I've been exposed to great music, great movies, great TV shows on Netflix. I can leave some recommendations in the notes below if anyone is interested. I want to delve a little bit more into the business side of learning Spanish for physical therapists. According to an article by Forbes, the United States has the second largest population of Spanish speakers. States with the highest Hispanic populations include California, Texas, New Mexico, Arizona, and Florida. In the state that I currently reside in, North Carolina, Hispanics and Latinos make up about 10% of the total state population. In the county that I reside in, Hispanics and Latinos are about 14% of the population of Harnett County. Now, this could be me, and the social media robots are listening in and seeing the searches that I make, but I get a lot of bilingual advertisements. I'll sometimes be on YouTube and I'll get a commercial for car insurance that is completely in Spanish. The point I want to try to make with that is that many companies are making it a point to be inclusive of Spanish speakers in order to reach an entirely new demographic of potential customers. And I believe that physical therapists can do the same thing as well. Many patients who can only speak Spanish will be deliberately seeking out healthcare providers that do speak their language. And just for fun, I looked in my county in the zip code that I am in. There's only one physical therapist in my county that speaks Spanish. So, considering the population of Spanish speakers in the county that I am in right now, I do imagine he may get a lot of business from them. And why is it important for Spanish speakers to be able to seek out a healthcare provider that can speak their language? Well, oftentimes there are some discrepancies between language barriers and health outcomes. According to an article that I came across, language barriers are associated with a range of poor health outcomes, including increased lengths of stay in hospital, readmission rates, inferior chronic disease management, low quality of informed consent, and a greater risk of adverse medical events. So, as y'all can see, the stakes are a lot higher if there are some discrepancies in healthcare due to language barriers. I believe that physical therapists have the great opportunity to help, again, to bridge that gap and to improve healthcare outcomes and make everything a little bit more accessible and inclusive of everyone. Currently in the physical therapy profession, about 2.4% of the members of the American Physical Therapy Association have identified their race as Hispanic and Latino, and about 6% of DPT students in 2019 identified their race as Hispanic and Latino. So, right now, we are slowly starting to try to push for more diversity within the physical therapy profession so that people who are seeking healthcare are more likely to be able to come across a healthcare provider that looks like them and can really understand them. But in the meantime, physical therapists can try to learn Spanish themselves and to help to bridge that gap until the population has caught up. I did a search on physical therapy schools that offer a course in Spanish for physical therapists. This could be an elective course, this could be a complete required course, medical Spanish for physical therapists. 4 universities currently require physical therapists to participate in a Spanish language course. This is Florida Gulf Coast University, Lebanon Valley College in Pennsylvania, University of Texas at El Paso, and University of Texas Medical Branch at Galveston. Other physical therapy programs that offer some elective Spanish courses are Columbia University, Des Moines University, Emory University, Franklin Pierce University, Pacific University, Samuel Merritt University, University of New Mexico, and University of Wisconsin-Madison. Some other schools in Florida have started offering medical Spanish for physical therapists. This is the University of South Florida, the University of Miami, and Florida Gulf Coast University. While doing research for this podcast, I came across an article titled Integrating Spanish Language Training Across a Doctor of Physical Therapy Curriculum, a case report of one program's evolving model by Dr. Celia Pechak and others. I reached out to Dr. Pechak to request an interview, and I am very lucky to have gotten an interview with Dr. Pechak. And she brought on Sandra Terrazas, a physical therapist in the El Paso area too, who really was integral in implementing a Spanish curriculum into a Doctor of Physical Therapy curriculum. University of Texas at El Paso, they have medical Spanish course, they have service learning opportunities with Spanish-speaking community members, and they also have clinical education opportunities with Spanish speaking. And there are learning opportunities that are interwoven closely throughout the course. So now I'm going to play my interview with the two ladies. Okay. Good morning. Thank you everyone for tuning in. My name is Rachel and I'm here with Dr. Pechak and Dr. Sandra Terrazas. Could y'all please introduce yourselves?
Hi, good morning. I'm Dr. Celia Pechak. I'm a professor and associate program director at the Doctor of Physical Therapy program at the University of Texas at El Paso, which is right on the U.S.-Mexico border.
Hi, my name is Sandra Terrazas. I'm a physical therapist. I'm the owner of Spectrum Therapy Consultants in El Paso, and I am adjunct faculty at the University of Texas at El Paso's PT department.
Wonderful. So I came across these two ladies when I was researching for this project. I came across Dr. Pechak's article about integrating Spanish language across the Doctor of Physical Therapy curriculum and a case report of one's program evolving model. I'll put this in the notes below. So first question I would just like to ask is, what made y'all decide to try to incorporate that into being a permanent part of your curriculum?
We transitioned from a Master of Physical Therapy program to a Doctor of Physical Therapy program. Well, the first class that graduated was 2012. It was actually before I got here. Sandra was very well connected to the program at that point. But the idea would be that we wanted to serve our community, and we have many Spanish-speaking clients with limited English proficiency. And so we thought it was very important for our students to be prepared to meet the mission of actually serving our community. But I'll actually ask Sandra maybe to give a little more history, because she's been connected to the program actually longer than I
have. I was approached about this class at a very difficult time in our country. At the time that I was asked to do this, there was a huge push for English only in schools, and that's everything you saw on the news. And they were trying to take away any kind of bilingual programs that were out throughout the country. And it was a little controversial time. And so when I was asked to do this, gosh, because this is the first time that this was going to be a mandatory part of any curriculum. And at the time that we did this, there was only 2 universities, PT schools, that offered Spanish as an elective. And this would be a forced, a mandatory Spanish part of the curriculum. And so I agreed to do it. I guess my background is I'm a first generation American. And so my whole family was born and raised in Mexico across the border. And my mom immigrated into this country. And then I was born here, and there are a lot of border issues that we have that are distinctly different than the rest of the country. And so we struggled early on because at home, my mother wanted me to speak English. And it was such a forced thing because that was the future for us kids. And I also realized my first language was Spanish, but I quickly realized that there was a lot of disparity amongst people that have a language barrier. And I wanted my mother to have the exact same kind of care, and all Hispanics to have the exact same kind of care and access to care from the most capable of people. And therefore, I was really passionate about being involved with this program.
Oh, wow. Thank you for sharing that side of me. So I'm just kind of going off of what you said. So did your family have to deliberately go out of their way to be able to find a healthcare provider, not just PT or anything, that spoke their language?
You're breaking up a little bit, Rachel.
Oh, sorry. My question was, I was asking, just going off of what you said. So did your mother or anybody else in your family have to just deliberately go out of their way to be able to find a healthcare provider that spoke Spanish?
Entirely. And so they would have to always have me as the translator, because I was one of the few kids that spoke English and Spanish, and that was literate, that could actually write. And so when I was a young child, I was probably 6 or 7 years old, I would go with them to doctor's appointments to translate. I would fill out applications for employment for them, and just register my cousins for school, the literacy part, and then all the forms were in English. And so I was really involved with that. And as far as healthcare, we always had to have a translator or somebody to be present, or most of the time, whether it was for financial reasons or comfort reasons, my family went across the border to Mexico to get healthcare services in a language that was understood and that was affordable and cost effective for them.
Wow. Like, I believe that lately there's been a push for healthcare to become more inclusive, especially in this past decade or so. But when it came to incorporating the program at University of Texas at El Paso, so was there a needs analysis conducted?
Well, the needs analysis was essentially the clinicians speaking to our faculty, right? So as any physical therapy program has, they probably there's an advisory board, and you have a whole network of clinical instructors who support the program. And as part of moving from master's to a doctoral level, there was even more sort of advising going on, right, to help shape the program. And so the needs of the community really demanded it for us, that we needed to bring Spanish in. So it would, I was not here right at the beginning of that, but I can tell you, having been here now over 12 years, it was certainly a no-brainer to do it. It was really more about how to do it. And quite honestly, to my knowledge, right, I can't speak for every DPT program in the country, but through my research, I don't think anybody does it quite like we do, even if you just think about the individual class. You know, we've had the support of Sandra as a private practice owner from the very beginning. And so our students don't sit in a class and have someone who's a Spanish teacher come and teach Spanish. Our students, originally it was the first semester, now it's second semester, go out to Sandra's clinics. And more specifically, you know, it's not just Sandra, she has been a mentor to other clinicians who then do the teaching of the Spanish right in the clinics where there's volunteer patients that hang out. And so our students are really interacting in Spanish in a very authentic location, which I think is very unique to how we approach Spanish class itself.
Very good. So is your curriculum, is it a combination of medical Spanish along with conversational Spanish?
Well, I think our class our course has evolved throughout the years, and we realized that we used to have like a beginner class and we used to have like an advanced class, and we found that every semester everything was different, and we always had in the middle. And so they were really high level Spanish or really low level, high level. And it was really difficult to really bring it out of all our students. And so what we decided to do, because I have the private practices, I was able to mentor several grads from our PT program at UTEP to teach the beginner, the intermediate, and the advanced level class. And so I teach the beginner class. I love the beginner class. So I always call my beginner class the tacos, burritos, dos Equis class, because that's all they know how to say when they get to my class. And then we have the advanced class where they really, really work on the eloquent Spanish. So the intermediate is the in-between. So we don't do traditional grammar teaching like you would in a new language. I'm about 70% fluent in French, and I understand a ton of Italian, but it's not that type of a setting where you're conjugating verbs and so on and so forth. It's really to convey a message and to be able to have enough vocabulary if you do have a translator, whether it's a family member or a professional translator, to really understand that your message is getting conveyed, and that body language also gives you an idea of what is really happening. So for my beginner class, it's a lot of commands, and usually the sentences aren't 100% conjugated, but for the most part, by the end of the course, most students are able to get a decent history, meds, commands, and get stuck enough where the patients can definitely understand, or there are many patients who speak English and understand English, but have a horrible accent and are embarrassed to speak it. And so now what I found in with our students is that the patients now feel comfortable enough to teach the students, but at the same time, they want to practice their English on the student. So it's worked out beautifully in many, many different ways.
Gotta love a mutually beneficial environment. In my experience, I used to work at a PT clinic north of Atlanta. I had one patient who only spoke Spanish. She was a very sweet, older abuela type of lady. And she would typically have her sons or her nephews come and be her interpreter unless she was able to get an actual interpreter in that day. And then earlier this year, I was at a clinic in North Carolina for my clinical, and my patient, he could speak English, but like you said, he had an accent, but he wasn't really afraid to speak in English, but I got to practice my Spanish on him, and kind of a lot of what you were saying, the commands, maybe they weren't conjugated correctly, but he loved that I was there to do that for him. I do want to talk a little bit about maybe a demographic relevance of Spanish and PT and finding faculty. So you guys are pretty much right next to the Mexico border, and I'm not all the way in North Carolina. And Texas has a very high percentage of Latinos and Hispanics. North Carolina, in the entire state, it's about 10% of total state population. In the county that I'm living in, it's about 14%. I'm in a pretty rural community. I actually looked on ZocDoc, and in my zip code, there's one physical therapist that can speak Spanish. So in terms of resources and availability, so what would be advice that you would give smaller programs in more rural areas like mine, being able to find faculty or being able to just really try to incorporate Spanish more into the curriculum?
Well, I think that there's probably lots of opportunities.
You can take this, Celia.
Okay. I think that there are a lot of opportunities that are going to probably continue to grow from our increased comfort of using technology, for sure, right? That we maybe wouldn't have even thought about a couple of years ago. In terms of, education, for sure, right? Taking advantage of faculty like Sandra from a distance to be able to zoom in and run classes, et cetera. But I just can't overstate the reminder that interpreters need to be used. Medical trained interpreters need to be used when you don't have someone who's fluent. So even, for example, Sandra's students that she talked about, we tell them, you're not going to leave our program fluent, but you're going to be able to establish rapport and sort of demonstrate a respect to your patients about their primary language. But when it comes down to really exchanging important information around doing an excellent evaluation, you need to be using a trained interpreter. And the beauty is now, right, there's so many more opportunities than one human being standing next to you. There's with iPads and everything else, right? There's so many other ways to bring in interpreting services. So I know I'm not exactly directly answering your question, Rachel. I mean, the one hand, you use technology to teach students, but the other part is just not to forget that we need to be using interpreters at the right time. And I'm not sure if you know about the class standards, but our class standards are the national standards saying culturally and linguistically appropriate care to our patients. And so really people need to be truly fluent as physical therapists to be interacting with their patients without an interpreter. And as someone who, it is ironic that I am the faculty champion for Spanish in our program as a full-time faculty member. I myself am not fluent. I'm an intermediate speaker, a lifelong intermediate speaker who trips along with her Spanish. And I would use it with the patient to establish rapport. But do I need to be using only my Spanish to do a thorough evaluation? No, I need to have a trained interpreter. So I think to wrap it up, I think that going forward, there's so much opportunity to bring technology in terms of helping us learn our Spanish, as well as using trained interpreters when we should.
I'm very glad that you brought that up, Dr. Pechak, because I mean, it's a very high aspiration to become 100% fluent in Spanish, and as much as I have enjoyed learning it, it's a little bit harder for me to learn it fluently because I'm not a native speaker of the language. I don't have as much opportunity to practice it as much as I would love to, but it is so important just to be able to have that extra interpreter there for patient safety reasons and for your own personal safety reasons too. In fact, I did look a little bit more into some research, and there is just a little bit of a healthcare discrepancy between people who can only speak Spanish and the providers that can be able to bridge the gap for them as well. So, and it's in that article that they say just being able to provide that care for them, even if you're not 100% fluent in Spanish, you can help to improve healthcare outcomes. So, do you guys have any interesting stories about your students being able to practice the Spanish out in the field? And what has been some feedback from your students about this program?
Overall, our students have had really positive experiences, and our clinicians. I want to start by saying when we first switched over to adding Spanish, and it's not just the course that Sandra and her colleagues teach, but we integrate Spanish through our curricular courses, or our clinical courses. So for example, I teach the cardiopulm course, and we will, during lab, have them do a scenario in English and then do a scenario in Spanish. And certainly not every PT school could do that. At any given time, at least a third of our students are fluent speakers, often Spanish as their first language. So we always have simulated patients from our students who can speak Spanish. So that couldn't be done just anywhere, but our Spanish is not just the one course. I just want to be clear about that. And I want to mention that we're actually changing the name of our course from medical terminology to clinical Spanish. And so that gets the idea that, you know, we are always telling our students, stop using medical lingo in English, right, with your patients. And so it's the same thing. We're not trying to teach our students to use medical lingo in Spanish. We're trying to have them use clinically relevant Spanish, with the exception of the advanced speakers, right? Our advanced speakers have such high knowledge of Spanish already that then we may actually be working with them on more formal medical terms. But to go back to your question, our students now fully embrace our Spanish mission. When we first switched over, some students came to our program just because we're a PT program, because we didn't communicate well our commitment and mission to working on Spanish. Some of those earlier students, quite honestly, it kind of reflected what Sandra said, were kind of like, I didn't come here to learn Spanish. I came here to be a PT, or it has nothing to do with being a PT. So that we don't get those students anymore. People know if they're going to come to us, they're going to work on their Spanish. And so the students come back, I think, with a real sense of satisfaction that they could connect with their patients. And I think particularly our students who leave our area, who have only maybe been raised here and are used to this bilingual community we live in, really recognition that they bring a real talent and important skill to be able to communicate with Spanish-speaking patients outside of our region, and you know how much their patients appreciate it. We certainly have students that come back that are committed then to advancing further with their Spanish. Someone like you, Rachel, who wants to continue onward. And what I would tell you to do is someone like you needs to, when you graduate from Campbell, you come on down here and take a job in our region, and you really can immerse yourself, right? You could work at a location that, well, most of our locations, except for probably the VA, and have very high Spanish speaking communities. And then, you know, you could live in parts of the town, maybe that more Spanish and less English is spoken. And we really are, I mean, I've done immersion in Central America as well, right? We are really a community in our own country where you can do that. So we get extremely positive feedback. What I'm working on, my additional research, is to say, okay, but can we really track in an objective way that our student Spanish is improving? So my colleagues and I are working on the physical therapy Spanish proficiency measure, which would be an outcome measure that would really allow our clinical instructors to document sort of a score at the beginning and then a score at the end, and so that we can really say the student has improved. And more specifically, we can say, yes, you are safe to use your Spanish in the clinic, right? As opposed to someone like me who's really safe to talk about what they had for lunch and how many grandchildren they have, right? And so maybe we can conversationally speak without an interpreter, but when I'm doing physical therapy evaluation and examination, I need an interpreter. So that's the direction we're going in, to try to sort of add more rigor to our Spanish so that we can sort of tell students at the end, yes, you're safe. No, you're not yet safe. You need to be using an interpreter.
I think also in the beginning, with the faculty that was at the campus, all were non-Spanish speakers, and they embraced supporting this like you can't imagine. And then along came Celia, who really took this to a different level. And then just recently, I guess it's been 3 years now, the program director, 4 years now, wow. The program director is actually Chilean and fluent in Spanish. And this was probably one and other reasons that he ended up moving from Indiana to El Paso, and has embraced the program, embraced everything that has come with it. I think something that our goal is cultural proficiency. And so even if you couldn't speak, even after you're going to speak after my class is over, but even if you didn't, you at least can relate to the cultural differences and eye-opening experiences that people don't even think about happen in our area. And so it gives you a different sensitivity towards patient care that allows you to have that wide open relationship with a patient, to bond, to really provide greater care, because at least you know where these folks are coming from. And it can be transferred to a Vietnamese culture, every culture. It just opens your eyes to seeing that there is a different world outside of your own.
Yeah, I just have got to support what Sandra just said, right? Like, even if our students don't come out fluent, which many of them won't, it's that respect for another culture and understanding that how vulnerable our patients are when they don't speak Spanish in a healthcare setting, and to have that human compassion and empathy for it. I love our local students. We're here to serve our community, but I love when we get a student totally away from El Paso who comes in and is actually, when it's someone like me, an Anglo, who's a minority and experiences being a minority in a majority Hispanic culture where there's another language that's very much a part of our DNA here. And their lights go on where they understand what it's like to be the other. And I think that's what I bring, even though my Spanish, I always joke, I sound like a drunk 2-year-old, but what I think I bring to this program is that I have been the other, living overseas, I worked for 6 years in Hawaii, where there's so many cultures and so many languages. And I just think the best experience you can give to anybody, but particularly these DPT students who we're trying to form into being outstanding therapists, is to experience being the other and developing that compassion and empathy for their future patients who the data show are going to experience healthcare access disparities and health outcomes disparities if their English isn't proficient, and having an awareness of that.
And I'll tell you, Rachel, one other experience, and this is where you have to believe in fate and that things happen for a reason. I have been going to Guatemala and Central America for 25 years on orthopedic medical mission trips. And I was doing my thing. Celia was doing her thing in Guatemala. And it was only until I was looking at an alumni magazine from UTEP that I see Celia in Guatemala with OT and ST students. And I look at the background and I'm like, that's the same hospital that I go to. And I called Celia and I said, do you guys go to Obras in Antigua? She's like, yeah. I was like, oh my God. And so it was like this connection. So then when the Spanish thing took place, and really evolved, then we started taking students. I started taking students with me on that medical mission trip for that week. And the majority of the students have been from my beginner class who still wanted to pursue that. And I've had a student who has since graduated and is in Chicago, and she has gone on her own without me. And we try to every other year go together, and she's South Korean. And so it's the rewards that this class has, or this course has given us back, and I'm sure given to all these patients, is you can't study that. So yeah, you just can't. You can't research that and have a great study on that. But there's so much that I know that has come out of this.
Oh, wow, that's just wonderful. I really love both of y'all's perspectives on that. I'm so glad that you talked about cultural competencies. At my program, we spent about a few semesters learning about cultural competency. It's in my community in North Carolina. It is primarily English speaking, obviously, and primarily Caucasian, but we do boast a pretty wide cultural variety around here. So our goal is just be able to provide the best patient care possible. And sometimes that is just being able to adapt just to someone else's culture and understand where they came from. I mean, not even just exclusively Spanish, but other ethnicities and races too. I mean, personally, I just can't really speak for the wonders that it's done for me personally and professionally, just to be able to see an entirely different culture and just learn about it. And it's so easy for someone like me to be able to go get healthcare if I need to. If I need to go to the dentist, I can just make an appointment and it's fine. But some other people don't really get that opportunity to do that. And in America, English is not the official language. Spanish is obviously a very big part of our culture too. America can boast being just an entirely melting pot of cultures. So it goes into that too. It's just so important for us to really just to learn about each other and to really appreciate our differences and what we have in common. Yeah, maybe you guys have noticed there's just been a very big boom lately about bilingual marketing. So and sometimes when I'm on YouTube or if I'm watching TV, I'll get commercials in English and Spanish. Maybe it's just the marketing robots listening in and they see my Google searches, but it's inclusionary marketing. So you're reaching out to an entirely new demographic of people. And it just kind of makes sense for me for physical therapists to be able to offer that too. And
Rachel, right now, yes, we have since you're on that topic, all of our literature in all our clinics is English and Spanish. Everything that our new patient information is in English and Spanish. Through WebPT, there's 8 languages that you can just click the HEP, the home exercise program, click it, and it turns it into one of those 8 languages in a snap. Our newsletters are bilingual that go to our existing patients that we do digital marketing via email and also via snail mail that we send patients. It's through Practice Promotions. They have that service. We just started looking into 2 different platforms and piloted one for a month. It's called MPR, and it's Management Physician Referrals. And it's basically a form of, now that we have direct access in Texas, it's a method of getting direct access to patients by directly going after the consumer. And we did it in both languages. And we got inundated. And that's why we only had to pilot it for 1 month, because I had to pull the plug, because I realized I needed 1 full-time person just to manage that. And then my stumbling block was, I realized we did it in Spanish and English, and 75% of the leads and hits that we got were in Spanish. And then we realized that those patients that were coming in, of those that were Spanish speaking, many of them were coming, and we offer a screen. That's the whole point. You get a lead. it's geofencing. So we did it around one location of zip codes. And so we were trying to promote our new clinic that had just opened. So we tried this, and the patients that were coming in, the 50% of them that were coming in for their screening were not insured. So those were true direct access patients that were coming to us that would be cash pay that we could see. However, most of them were coming in for medical issues like venous insufficiency, cardiac issues. They thought it was a shoulder issue, but they're having jaw referred pain. And so, so that prompted me to then get prescription pads so that we could refer to the right specialists. Okay. We also realized that the other 25% of those patients that came in that were Spanish speaking were insured, but didn't have a PCP. Okay. And so right now, direct access is kind of screwy for us, because if you are insured, some require prescription to be paid and some insurances don't. So we're in the process of figuring all that out. And so then I realized that I needed to get PCPs for all these patients that are insured, that were in their 40s and never had gotten a physical. And so then now I've gone marketing to different physicians, and here are all my cards for all my doctors that I went to go see. And I said, look, I've got this digital marketing situation that I'm going after consumers, but I need a referral from you. But these patients need to establish a PCP in their life. And, this is a reciprocating way to collaborate with you with these patients' healthcare needs. Are you in to help me or not? And of course, because basically I'm marketing a patient for them as well. And so we had to pull the plug because I need a dedicated full-time person that can do this. And we're going to get back to it. We're just having a bunch of hiring issues here just because of COVID. Nobody wants to work. So that for Spanish marketing is the wave to go. So we are in a really unique situation where that can be done. And because I am fluent in Spanish, and many other PTs are fluent in Spanish, but they're not practice owners. And so these opportunities are great to have screenings, to have, workshops where patients come in with shoulder pain. And if you're able to talk the exact same way and flip the switch to a fluent other language, then, there goes your business model.
Oh, I really love that interjection there, Dr. Terrazas. That was wonderful.
It's Sandra. I don't have my doctorate.
Okay, Sandra. Thank you very much, Sandra. And I'm very used to it because of all my faculty. Last question I do want to talk about. Last question I do want to talk about. In my program back in January of this year, we started a physical therapist, Spanish for physical therapist student interest group. We had a lot of interest in it because, it's not like just an extra skill to have. But what we had, and you guys have had it in your program too, people have different levels of Spanish experience. And some people realize that when we were going through that interest group, I don't know any Spanish. I don't know what's going on. I'm just kind of like passively absorbing things without really knowing what's going on. So for programs like mine, and my advice would be like when we start up the student interest group again in January before I run off to clinicals, and I guess kind of going off of that too, people who want to do it versus actually doing it. So how can we just try to make the Spanish student interest group a little bit more inclusive of all different levels of proficiency in Spanish?
Well, as Sandra mentioned, we really found the sweet spot for us is, having sort of 3 levels. And so I don't know how many of your students are interested, but I think part of it is hard if you just try to lump everybody together. The people at the highest are going to get bored. The people at the lowest are going to be lost. And so to try to create sort of 3 groups, and obviously the beginners are going to need like an advanced speaker leading them. so there'll need to be some sort of leadership. The other thing is I think that there's a really potential more broadly for PT programs, group students to get together again using technology, right? So let's say you have, 20 students in your cohort that are interested in Spanish, but that's across 3 different levels. can you get together with 1, 2, or 3 other programs? And so suddenly you've got, 40 students in each group or whatever, right? So that you build to a greater capacity. And I will say over the past several years, we have students like you reach out to us here and there, not necessarily by podcast, but student interest groups and what they're doing. And I hear from them for about a year and then they drop off, right? Because they leave their campus and then they go do their clinicals and then they're clinicians. So I think that there really is room for something to be created across universities that might be more sustainable and that will be carried on. And so I think that would be a really great opportunity, so that there's sort of a central location that keeps carrying on sort of these strategies long after someone like you has graduated, and maybe someone like you isn't going to be back in your program again for 3 or 4 more years, and by which time the institutional memory will be gone that you were ever there with that kind of group. But we do a lunch and learn, and that's one thing that is another way that we've sort of integrated Spanish, is that we do have Dr. Grulovich, who is our program director and is fully fluent in Spanish as his first language. So he runs that at lunch. And so it's a little bit more informal. It's sort of structured but unstructured. And students get either extra course credit for attending it, or we have professional development hours that students need to get. And so I think there's other ways to sort of institutionalize Spanish into the program. Do you not have any faculty that are interested in Spanish in your program, Rachel?
We have one faculty who is fluent in Spanish, and she's also fluent in French. She's such a wonderful woman. We have one faculty who's joined us from Brazil, and she speaks Portuguese, but there is a little bit of overlap, and I think it's just that she's able to kind of provide a little bit more of a unique experience of teaching a foreign language from a foreigner's perspective.
Well, that's great. I think then you're ahead of a lot of schools, because a lot of times they have no faculty to sort of provide any of that support.
I have a few. I was just going to say, I have got a few classmates who are one's from Venezuela, other one's from Colombia, and they grew up speaking Spanish. So I can, we have that perspective too.
Rachel, while we were early doing this, and this is before Celia joined us, we have a medical school through Texas Tech here in El Paso. And the med school has Spanish incorporated into their curriculum as well. So, and they have simulations with patients and so on and so forth. And geographically, it's probably a 10-minute drive from the university, from the PT program. And so initially we had thought of trying to get the advanced students to shadow the orthopedists, the ER docs, and neurology and pediatricians, to just maybe do rounds with them and start getting the medical Spanish and verbiage, because they're already fluent. But what they'll always say is, wow, I didn't know that was the word for a gallbladder. So they don't have the medical Spanish, okay? Or it's a slang type of Spanish, like gallbladder is, it's vaso, and vaso is the glass. And so you're like, what? But it's actually la vesícula. So it's that was like one of our things. So I don't know if within your med school or your region, if you could collaborate with other disciplines, like Celia mentioned, as a starting point. And the levels is always what's going to get you. And so you may even just have a special interest group that's beginner Spanish, and you have an advanced leader, and you start there. And as there's more interest, and typically your leader is going to be the one that's going to find the need and hopefully have the passion to then be more inclusive of the intermediates and then the advanced speakers.
A lot of high aspirations, just being able to actually put the plan to action. So if I've learned anything this semester, you can plan all you want. Sometimes it won't work out the way that you do, but part of being a PT is being flexible. What you said about the different words for different things, it reminded me of when I was studying the wrist the other day, and sometimes I write my notes, like and the English word and the Spanish word, and it was la muñeca, which can mean doll too. And I was so confused for a second.
Yeah.
Like, which one is it?
It's that one.
That one. Whichever one it is, whichever one it is.
Yeah, whatever's in front of you, a wrist or a doll. I wanted to just highlight that one of the issues that probably not is affecting you, Rachel, directly, but maybe some of the students you just mentioned that are from Latin America, is that there can be an expectation that our advanced speakers need to then serve as medical interpreters for others. And I just always try to highlight with our advanced speakers that they're not obligated to do that. And in fact, there's potential ethical and legal concerns because they're actually not trained interpreters. They may be bilingual, but that doesn't make them trained interpreters. And so that is an issue that I think is worthy of reflection by our students, that they're going to go out into the clinic, and if they know any Spanish, they're going to get pulled into situations. And actually, Sandra has a very dramatic story of that as herself as a clinician of being drugged into the middle of acting as an interpreter in a way that was actually quite unfair to her and into the situation. So I just want to make sure that we all often think of just the beginners, but the advanced speakers can end up having some of their own problems and not being able to do their own work because suddenly they're interpreters. Since I brought it up, Sandra, that you know which one I'm talking about, the NICU.
Yeah. I was working in acute care and I was in the ICU and I was seeing patients within the ICU unit, and a neurosurgeon asked me if I could help him interpret. And I said, sure. And he pulled me out of the ICU unit into the waiting room. And he didn't warn me or anything. He just wanted me to translate what he was saying. And so I walked into a room full of family members, and he was basically asking me to tell them that the EEG came back flat, and that essentially their 24-year-old loved one was brain dead, and that the social worker would be calling them, would be coming in and speaking to them to decide if they would be willing to harvest her organs for transplant, to give other people the opportunity to have a better life. And as I was saying this, I started, the room, there's always one leader who's listening. And as the depth of the room started to basically fall apart as I was in there emotionally. And I felt like it was so crude because I was almost insensitive because I was just literally translating word for word what he was saying and couldn't and say, fortunate I would have been a little better prepared.
I'm just blown away, honestly. I think he had the right idea in mind, just the execution of that wasn't too good. But I'm glad that you could be there for that family and the capacity that you could be.
These are the experiences that have made me really be passionate about teaching the course, and sharing some of those things with students. And the Miranda rights, somebody got off on murder because he couldn't understand what he was under arrest for, and got off, and that's where that happened. And in healthcare, there's so many factors that can get lost in translation, and not only translation, but knowledge base of understanding. Some patients think that they're going into surgery to have their leg saved when in fact they're removing a leg. So there's a knowledge base besides the language barrier, so that patients understand, that maybe a stent isn't going to save them and that they may die, or the just false expectations and hope patients have in healthcare professionals because they don't understand what's going to happen and the consequence thereafter.
Just had to take a moment to really reflect on all of that. Okay. Well, we are coming up near the very end of our time. Unfortunately, I guess I could talk all day, but I know y'all have other responsibilities. That's my big conclusion that I want to talk about. It's just, I really do think that learning Spanish, especially if you are in an area with a lot of Latinos or Hispanics, just being able to speak Spanish can really help to bridge the gap between being able to people who need the healthcare and being able to just, again, be able to meet them halfway in terms of cultural proficiency, building that rapport, having your patient feel safe and secure with you. And I do think that it is something that can really change the PT profession, especially considering, well, we have at least 2.4%, according to APTA statistics, of Hispanics and Latinos. And that's just the members of APTA that identify as Latino or Hispanic. And we've had a little bit more PT students that identify as Latino and Hispanic. So we have a discrepancy in terms of people who can provide that naturally and fluently, besides people who, like me, want to learn the language and be able to bridge that gap. So before we go, is there any parting shots that you guys would like to end on?
Well, I guess I always come back to it's all about the patient, right? We're trying to do what's right by our patients, and in our country, and certainly in many parts of our country, the demographics demand that we have fluent Spanish speakers or bilingual. But again, coming back to even if you don't attain fluency, having that second language can still help with patient rapport. And our research has shown that our students, no matter what level of Spanish they're at, they report personal and professional benefits from getting that Spanish. And so it's for the patient, but then we end up benefiting ourselves. And I've tried to help create a program here at UTEP that was a program that I wished I'd had 40 years ago, right, where I really could have developed greater fluency in a second language. And I think it's a powerful gift to your patient, but to yourself, because the more you understand other people, the more you can weave yourself into your community and grow yourself. So I just can't overstate I think the benefit of it. And you've already talked about that, just learning that, right, helps you grow in other ways culturally, not just with Spanish speakers, but just gives you a greater awareness. So to me, it's a win-win-win-win all the way around. And I can't end without just really acknowledging my sister Sandra there and all she's done for the UTEP DPT program. She's certainly been the heart of this.
Thank you, Celia. And I think for me, Rachel, I've been blessed with being in a position and given the opportunity to teach this class, but also to have my private practices where I could bring in students to that and then share my experiences of going to Central America, but really truly having the human experience of going through what all patients have gone through, like my mother did, like my family has. And I think this is why I'm in healthcare, because I was bilingual and I was stuck in the hospital all day long when family members were in the hospital, unless I was in school. And so I was sitting in there all day while the adults were working and giving them updates on my aunt, my uncle, my cousin who was in the hospital, and translating for everybody. And then I was a child, I was 10, 12 years old, and asking, what's that machine for? And why does it beep like that? And what is this? And putting together in my own mind what medicines were for what and what surgery fixed what. So I think that experience for me shaped me to go into some form of medicine. And so I also saw the behavior of many healthcare workers when you didn't speak the language. And then as I was in PT school, I really saw it. There were times where I received only the Spanish speaking patients because as a student, because the staff knew that I could communicate and it would just be easier for me and them. And so I just saw from a different perspective those disparities. I won't call it discrimination. I think there's goodness in everybody, especially in healthcare. So I just wanted to make a difference and have this platform to be able to do it.
And we have lots of open jobs down here. So you students out there that want to work on your Spanish, come and work for Sandra and people like Sandra.
Voy a. En el futuro. Pues, muchas gracias por todos. Muchas gracias. But I hope you guys have a great rest of the day. Just like I said, thank you guys so much for taking the time to do this for me. And I'll be sure to send you the final link once it's all done.
Great. Thank you, Rachel. Good luck.
Nice to meet you, Rachel.
Okay, thank you very much. Have a great day. Ten buen
Obrigada.
día.
Buen
Hasta
día.
luego.
And there y'all have it. I am so glad that I got to talk to the two ladies about their experiences with incorporating Spanish into the program at University of Texas at El Paso, and also any challenges that they came across while the program has been running, and also their unique perspectives with being able to use the language practically. And I definitely appreciated Sandra's perspective, being that child that had to grow up being the bilingual translator for her family. Now that we know the background and we've heard the firsthand perspectives of people who have made Spanish a required part of their curriculum, what is next? If they haven't done so already, the program should conduct a needs analysis. Let's consider the geographic location of the program and the population of the community surrounding the program. What is the current population of Hispanics and Latinos, people who can only speak Spanish? Are there opportunities for students to be able to learn the content that they have learned in a practical manner and in the way that it is meant to be taught? Are there opportunities for students to find a job where they can utilize their Spanish speaking skills? This is important to increase student buy-in for incorporating Spanish into the program. Additionally, faculty must agree on incorporating Spanish into the curriculum too. There may be a champion faculty member that is leading the project, but again, there needs to be support from everyone involved and for the project to be a success. If programs are looking for a model to follow, University of Texas at El Paso has their Spanish language curriculum into 4 components. The first is Spanish medical terminology course, language learning opportunities threaded through the clinical courses, clinical education courses, and service learning. Again, if a program would like to be successful in incorporating Spanish, consider, are there ways that we can weave in Spanish opportunities in a clinical education setting or in service learning setting? At my program, our service learning setting, it could possibly include the migrant farmers clinic that we volunteer at periodically. Programs may also be interested in the flexibility on adapting and developing the curriculum according to the standards set forth by the Commission on Accreditation in Physical Therapy Education, also affectionately known as CAPTE. Let's review the standards that CAPTE has in place for programs. There are many standards and required elements for each standard that accredited physical therapy education programs must adhere to. And we can discuss these standards as they relate to implementation of Spanish into the curriculum. We'll first examine this first standard. The program meets graduate achievement measures and program outcomes related to its mission and goals. One required element, the mission of the program, is written and compatible with the mission of the institution, with the unit or units in which the program resides, and with contemporary preparation of physical therapists. So, incorporating Spanish into the curriculum would have to reflect the program's mission and vision in some way. The program must also have documented goals based on its mission that reflect contemporary physical therapy education, research, and practice, and that lead to expected program outcomes. I do believe that contemporary physical therapy education, the inclusion of Spanish in this education, can improve a program, especially if it makes geographic sense to do so. Another thing to consider is, are the mission and goals demonstrated by actual program outcomes? For the University of Texas at El Paso, they have their proficiency assessment to demonstrate, of course, proficiency as the students would continue through the program. Other programs can choose to emulate this model if they choose to do so, a model based on participation instead of grades. An additional standard, the program is engaged in effective, ongoing, formal, comprehensive processes for self-assessment and planning for the purpose of program improvement. This would, I think, be a good step for any physical therapy program to start to incorporate Spanish into their curriculum if they do believe that it will improve the purpose of their program. In order for this to occur, the program must provide an analysis of any relevant data and identifies needed program changes with expected timelines for implementation and reassessment. Of course, this timeline will have to reflect available resources, program outcomes, and workforce needs. So how will a program start to incorporate the Spanish into their curriculum? Do they have a faculty member that speaks Spanish? Is there an adjunct professor that they can bring in? Are there any other resources and opportunities for the students to learn language? Are we going to purchase textbooks, medical Spanish textbooks for the students? And is it needed in the region that the school is located in? Another consideration is the collective core associated and clinical education faculty meet program and curricular needs. So, does the Spanish language for physical therapists, does a course that focuses on that fit in with the rest of the courses that are part of the curriculum at the program? Would it make a lot of sense to include it in the program? Another thing to consider is that the program must demonstrate that they have the resources that are meeting the goals and needs for the curriculum and how they will continue to address those needs. Financial resources, staff, space, equipment, technology, materials, other things that I did previously mention. A strategic plan must be implemented to guide the future development of the curriculum. So it must also consider assessment results, any changes that are expected in higher education, the healthcare environment, and the nature of contemporary physical therapy practice. Of course, the healthcare environment and contemporary physical therapy practice will change, I believe, almost yearly, depending on what resources and research is made available, and additionally, how the population is expected to change. I mentioned earlier that the United States is the second largest population of Spanish speakers in the world, outside of South America, and it can be expected for the Hispanic and Latino population to continue to increase. And as long as we have people who speak Spanish seeking healthcare, they're going to be seeking physical therapists. So they're going to be a part of the physical therapy scene. The third standard I want to address is the institution and program operate with integrity. Now, how this relates to the incorporation of Spanish into the curriculum is a point that came up during my interview with Dr. Pechak and Sandra. Even if a physical therapist learns Spanish, but they're not a native speaker, a lot of states require that an interpreter be present. So I believe that as this relates to the Spanish curriculum in physical therapy, is the inclusion of interpreters whenever they are needed, maybe for practical scenarios, lab scenarios. I believe programs need to practice and become used to that interaction of working with the patient who speaks Spanish, the interpreter who is required by law to be there, but also being able to use the Spanish that the physical therapist has learned. The Forbes standard states that the program faculty are qualified for their roles and effective in carrying out their responsibilities. The most obvious example for this is the faculty that is in charge of the medical Spanish for physical therapist course must be able to do their job, must be able to speak Spanish, act as an interpreter, and be able to teach effectively to their students. I can anticipate barriers if there are core faculty members that do not speak Spanish, and that can definitely be expected. So I believe faculty will have to work together to create a curriculum that can incorporate Spanish in a way that all the faculty member are qualified to do and make it still be effective. Maybe this could be the faculty member that does speak Spanish can be included in the labs or any other practicals or any other service learning opportunities, or the faculty will have to bring in an interpreter to fill that gap. The fifth standard states the program recruits, admits, and graduates students consistent with the mission and goals of the institution and the program and consistent with societal needs for physical therapy services for a diverse population. This means that physical therapy programs should aim to include a more diverse students in their population. Of course, a more diverse student population provides greater opportunities for the rest of the student body to improve their cultural competency and to understand a perspective outside of what they consider the norm. When it comes to incorporating Spanish into the curriculum, the students will hopefully understand that physical therapy has grown and changed a lot over the past 100 years, and that our services are not provided to cookie cutter patients. We will be meeting patients from all different walks of life, different backgrounds, and different languages. And if the students are coming to the program and they see that there's an opportunity to learn Spanish and be able to use Spanish in a physical therapy setting, these students will be consistent and buy in with the mission and goals of the institution, and will be able to provide physical therapy services for a more diverse population. And following up on that point, maybe programs need to examine what policies, procedures, and practices are related to their admission process, their retention process, and how students progress through their program. Of course, these standards need to be based on appropriate and equitable criteria, and also falling underneath the laws of the state that they are residing in. Standard 6, the program has a comprehensive curriculum plan. This curriculum plan is based on information about the contemporary practice of physical therapy, standards of practice, current literature, documents, publications, and other resources related to the profession, to the delivery of healthcare services, to physical therapy education, and to educational theory. This not only means that the physical therapy programs must be dedicated to providing the most up-to-date information about the standards of practice and other research out that is available. These also must consider the delivery of healthcare services. As that relates to Spanish, that would be the delivery of the Spanish language to the patient who can only speak Spanish. Is that coming straight from the healthcare provider, or is there an interpreter included in that equation as well? The program must also include interprofessional education with learning activities that are directed toward the development of interprofessional competencies, including, but not limited to, values and ethics, communication, professional roles and responsibilities, and teamwork. This is a pretty newer element that became effective in January of 2018. This can place the physical therapy student in a scenario where the healthcare team does not speak Spanish and they are all working with a patient that can only speak Spanish. Different healthcare providers have different roles that must be carried out in order to improve patient outcomes. So what happens when we have to include an interpreter in that scenario? And how can a physical therapist work with the other healthcare providers in an effective manner that's also professional and values ethics? We had an example from Sandra, as mentioned earlier, when she had to deliver devastating news to a family about their loved one in a way that was not very sensitive. So if there's some ways that programs can include the right way to navigate tense situations with a language barrier, that can help to prevent scenarios like that from occurring in the future. A subcomponent of the sixth standard states the curriculum plan includes a variety of effective test and measures and evaluation processes where faculty can determine whether students have achieved learning objectives. And again, University of Texas has developed their proficiency model that can be implemented that isn't based on grade, but more or less the students' participation and their proficiency. We're not expecting students to be fluent in the delivery of their Spanish, and it's more about how they're delivering the Spanish that they do know to the patient. Are they using it in an effective manner that helps for the patient to feel comfortable and establish trust in the physical therapist? And I think that is very similar to any skills check or practicals that I have in my program at the moment. If the faculty feel the students are where they need to be in regards to their Spanish language and the rest of their education, then I think everything is going very well. The student is safe to be a physical therapist and safe to use their Spanish in a way that improves their practice. This last standard, standard number 7, is probably my favorite one. The curriculum includes content, learning experiences, and student testing and evaluation processes designed to prepare students to achieve educational outcomes required for initial practice in physical therapy and for lifelong learning necessary for functioning within an ever-changing healthcare environment. That goes back to what I've been saying about the face of physical therapy patients is changing daily, weekly, monthly, and yearly. Again, physical therapy has changed so much over the past 5 years, past decade, past century. Physical therapists are expected to stay up to date with the ever-changing healthcare environment. If we are starting to have a larger Hispanic population that can only speak Spanish and are seeking out healthcare, again, they are going to be seeking out a healthcare provider that can speak their language. So I believe because of this, if physical therapy programs can get ahead of the curve, their students, when they graduate, can feel prepared to be able to provide healthcare services to a variety of patients, including those that don't speak their language. The content in the curriculum must be relevant to the ever-changing healthcare environment, and learning experiences beyond the classroom must reflect this as well. I mentioned earlier how we have a migrant farmers clinic near my program. That's an example of a learning experience for students to be able to practice the skills that they have learned for testing and evaluation, but also to practice, again, their Spanish speaking skills and working with an interpreter if that opportunity is available. Maybe some other things programs can do is try to recruit volunteers to come in and be practice patients for their students if laws permit that to happen. The last standard, Standard 8, states the program resources are sufficient to meet the current and projected needs of the program. As that again relates to incorporating Spanish into the curriculum, where are we at now? How successful are we with implementing Spanish? And how do we anticipate the needs of the program evolving? This ties back to what I mentioned earlier. Are there enough faculty, and can the faculty carry out the responsibilities of the curriculum, including incorporating Spanish? There may be a new component of the budget to reflect that there are financial resources that are adequate to achieve the program's stated mission goals and expected program outcomes, and to support the academic integrity and continuing viability of the program. So all programs must be able to examine the resources that they have available, examine if incorporating Spanish can be something that is feasible and sustainable in the long run. And that will conclude my podcast today. To summarize my main points, the United States has a large population of Spanish speakers. The population is expected to continue growing. Physical therapists have a wonderful opportunity to offer their services to an entirely new population of patients if they can speak Spanish as well. So if a program is interested in implementing Spanish into their program, consider feasibility, sustainability, and that will tie back to resources available that are human resources, technological resources, and financial resources. The program must consider a way for incorporating Spanish into their curriculum that aligns with the core values of APTA and also the mission and vision of that program as well. It would definitely be helpful for the program to be committed to improving diversity in their admitted students. Not only will this possibly increase the number of Latinos or Hispanics and Latinos in their student population, but it'll also provide many other opportunities to improve cultural competency. Program must also consider how they're going to conduct an assessment of the students' current level of Spanish proficiency. I imagine it can be pretty similar to a skills check and practical that I do at my program, just for the faculty to be aware of where their students should be based on their academic backgrounds, their personal backgrounds, and any clinical experience they have. We're not expecting students to be fluent and 100% perfect in their Spanish, but again, how are they delivering the Spanish that they do know? It's similar to any other physical therapy skill. Are they always using their clinical reasoning? Can they gather their information in an effective way? The last thing to consider is how can the program continue to meet the needs that are changing in the physical therapy profession, especially as the population of Spanish speakers continues to grow in the United States, and how healthcare is expected to change in the next coming years. Thank you to my faculty, friends, and family for tuning into this podcast. Thank you to anyone else who happened to stumble across. I hope you learned a lot. I would also like to thank my patients, past, present, and future, for being my inspiration for many years and continuing to be my inspiration after I become a licensed physical therapist. And thank you again to everybody, and I hope everyone has a wonderful day.